Good afternoon. Thank you for joining the May membership meeting of the Greater Milwaukee Committee. I'm David Lubar, Chair of the GMC and CEO of Lubar & Co. We are meeting again via Zoom webinar. The GMC hosts these meetings every 2 weeks. We send you registration information in our regular newsletter. And please take note, in our newsletters each week, we interview a GMC member highlighting their experiences during the pandemic. We feel this provides interesting insight into a variety of sectors and how people are responding. We have a full agenda today with a number of speakers. And as in the past, the Q&A box will be open for the duration of today's seminar for you to submit questions to our presenters. Let me just briefly review the agenda. First, we will hear program updates from Julia Taylor. Then we will hear from Dan Buttery, President and CEO of the War Memorial, and Mike Grebe, who is Vice Chairman of the War Memorial, and previously CEO of Foley & Lardner and the Bradley Foundation. Then we will hear from today's keynote speaker, Jim Skogsbergh, President and CEO of Advocate Aurora Health. Then we will hear from Dr. John Raymond, CEO of the Medical College, for a COVID-19 health update, and from Jim Davis, Executive Vice President of Quest Diagnostics. Quest is now producing 25% of the COVID-19 tests and can share insight into why testing is so important to a smart reopening of our economy. Let me now turn it over to Julia Taylor to share GMC initiative updates. Julia?
Thank you, David, and welcome everybody. Our GMC initiatives have changed to respond to both the community and the business issues that we've all seen result from this pandemic. One of the biggest disruptions has been actually with summer internships. Many of them have been halted due to the virus, impacting students and organizations around the region. So the Commons is raising funds for a virtual summer internship program that's focused on technology, innovation, and professional development. This program is open to students from any college or university, and all degree programs apply. So if you have college kids home this summer and they need something to do, this is something to think about. Students will receive 150 hours of real world work and connections to professionals from an array of sectors. The demand for this program is very high. Within the first few days of launching the applications, we have received over 250 student applications from local colleges and universities, as well as from colleges across the country, which really confirms the high demand for the internships. If you're interested in sponsoring an intern, reach out to Michael Hostad at the GMC. There's a $3,000 fee to sponsor one student, and the student receives $1,500 of that as a stipend. We currently have full funding for 29 students. We have additional funding from MATC for 20 students with no stipend, but we do need to raise a match on that to fully fund those interns. And we hope to raise funds to provide 100 internships total. Like we were doing with all of our partners, we're working with Milwaukee Fellows to find the best way to support their interns, and are encouraging the Milwaukee Fellows to apply for the program, particularly where they would qualify for partner matches. If you're interested in supporting this program, whether it be particular students like Milwaukee Fellows or All in Milwaukee, or just a general gift, please make a comment in the Q&A box and we'll follow up with you. Like I mentioned, the demand for this program is high. We've moved very quickly to meet it, and we think it's important to provide our current students with internship experiences and keep them in the region. If we aren't able to receive the funding we need for the summer, we're going to roll the program into fall. But we also want to thank Milwaukee Tech Hub Coalition for the seed funding to launch the program, to the Higher Educational Regional Alliance for supporting student access across the virtual internships. Scale Up Milwaukee is hosting a number of virtual meetings and office hours with small business owners around the region, focused on strategies to reduce their risk in the pandemic and how to grow in the future. GMC member Jerry Gendusa, who's also co-chair of Scale Up, provided insight to these entrepreneurs during a virtual membership meeting last week. And as the COVID-19 pandemic impact on small businesses unfolds, Brew City Match is taking action to help ensure the support of the Brew City Match businesses. They've developed 2 tools to ease the financial burden for small business owners: Brew City Match COVID-19 small business grants that provide up to $1,200 per business to assist with rent and payroll support, and then the Small Business Emergency Loan Fund that provides 0 interest loans to small businesses to help with rent, payroll, and additional business expenses. So that's where we're at with our programs. It's now my pleasure to turn the podium over to Mike Creeby to introduce our next speaker. Mike is the War Memorial Center's Vice Chairman, is a West Point military graduate, a veteran of the Vietnam War, and also, most fondly for us, past chairman of the Greater Milwaukee Committee. Welcome, Mike.
Thank you, Julia.
I hate to interrupt for a second. Mike, your video is not starting. It's not showing. There we go.
I'm sorry about that. Thank you, Julia. My hunch is that some of the GMC members who know me were quite amused to see that photo from my high school yearbook. But let's talk about the War Memorial. For 70 years now, the War Memorial has been an important and an iconic monument on our lakefront, honoring Milwaukee citizens who lost their lives in defense of our country. In recent years, the War Memorial has become more than that. It's now a venue and an organization that provides services to veterans and educational opportunities for the broader community, particularly for young people. Last year, we had several thousand school children visit the center for education programs. 2020 is a very important year for the War Memorial. First of all, we're undergoing some significant renovations to our building and the adjacent property. The parking lot to the north of the building is getting a complete makeover. Work is well underway, and it's being done in an environmentally sensitive way with much improved water runoff. And that will in turn enable us to have much more of a park-like setting rather than the slab of asphalt you've been used to seeing. 2020 is, we're also getting a new roof, a much needed new roof. 2020 is also important because we're hosting a series of events celebrating the 75th anniversary of the end of World War II. With us today to talk generally about the War Memorial and also about the World War II events is our President and CEO, Dan Buttery. Dan is a veteran. He was an officer in the United States Army Corps of Engineers with a tour of duty in Iraq. Some of you, I'm sure, will remember Dan as the founder and the first CEO of the Fisher House at the Milwaukee VA Medical Center. As you know, the Fisher House provides accommodations free of charge to the families of veterans who are undergoing treatment at the VA hospital. And I think the Fisher House in Milwaukee is the only one that was built and sustained entirely with local funds without reliance on the Fisher Foundation. We are delighted to have Dan with us. He's been our CEO since January. We look forward to his leadership as he takes us through the next chapter in our history. It's a pleasure to introduce Dan Buttery.
Thank you, Mike, and thank you to the Greater Milwaukee Committee for the opportunity to present today. And as Mike had referenced, we are really celebrating 2020 as a pivotal year for the War Memorial, and many of you are familiar with this beautiful structure. It's located right on the lakeshore of Lake Michigan and was designed by preeminent architect Eero Saarinen. And I would encourage many of you to do tours when we are back to the new normal And the campus is open because there's so many unique features and characteristics of this beautiful building that placed, of course, next to the most gorgeous Calatrava and the Art Museum. But there's an interesting history between that combination and the shared facility. But ultimately, the War Memorial was envisioned in 1945, and within weeks of starting here a few months back, I found the original paperwork that was filed in October of 1944 to establish the 501c3, which eventually becomes known as the War Memorial Center. It does take a few years to raise the money. It was the largest fundraising campaign in the history of Milwaukee at the time. And it was eventually built and opened to the public on Veterans Day of 1957. But now you have both World War II and the Korean War in between there. So then when it was opened, it was to initially memorialize those from the greater Milwaukee community who were killed in action as a memorial. But in Eero Saarinen's design, he wanted it to be more than a memorial. It's also a living and breathing space where people can meet and gather. And in fact, the Layton Art Gallery and the Layton School of Art, there's a section in the original building where that was moved into. And so the combination of art and memory of service has always been part of this. So it's a pretty impactful history. And so with 2020 being the 75th anniversary of the end of World War II, and in fact, just on Friday, next slide, please. You may have heard some bells ringing in the greater Milwaukee area. The commemorative airplanes flying over, that was to mark 75 years since victory in Europe, in the European theater. And in light of the COVID-19 and the safe distancing, of course, we were not able to have our remaining World War II veterans with us physically, but we did participate in a Facebook Live event. And there's some wonderful coverage in the local news media from Fox 6 and the Journal Sentinel that you can recap. So that was just last Friday, and it was a wonderful event. Next slide, please. Some of the events that we look to do and host throughout the year, an annual event that has been done is called Vet Fest, where we honor those currently serving in our service. Now, we wanted to still share this with you. Due to the COVID-19 situation, we found it our best interest as again, it's going to be a dial turn up, not a light switch, to ramp up and start hosting events. We have moved the activities out into the end of August to be part of the larger victory in Japan and the end of World War II ceremony. But as you can see, we have a gorgeous setting where every year we also host this to honor our veterans. And this would have been the kickoff of our 75th. However, fear not, we have some wonderful activities that we've scheduled throughout the year that we're able to continue with. Next slide, please. We've paired up with Tom Fehring, and many of you may know Tom. He is an author for the book Magnificent Machines of Milwaukee and Manufacturing. And recently, the Milwaukee School of Engineering had an exhibit on Milwaukee manufacturing. Well, he has sections in his book that he talks specifically about the Milwaukee war effort and the support on the home front looking forward. And so the image that you're seeing now is in Veterans Gallery, and recently acquired World War II posters that we have never had before are on display. And we're working with Tom to display in display cases Milwaukee manufacturing on the home front. And you'll recognize some of the manufacturers from Briggs & Stratton, A.O. Smith, to include Allen and Bradley. Allen Bradley was very involved, now Rockwell. And so a number of artifacts we're assembling with the assistance of Tom Fehring. And so that will be opening, and that will be an open event from August until the end of the year. And the intent was also to have that up and display for our Milwaukee Public School children that come through, upwards of 9,000 a year. We don't know, nobody knows what the fall will hold for that, but we will definitely have this on display within our new spacing and COVID-19 environment. But we look forward to bringing that open to the public, as I said, right around August 1st. Next slide, please. Part of the posters that we've described, you saw some of those in the imagery behind. They're fascinating. We've placed them in order of years, and so you'll be able to follow along the storyline of the messaging that was coming back to us on the home front, everything from buying war bonds, which most of us, I think, are familiar with, to things that you can do on the home front to help support. And so, as I mentioned, that'll open on August 1st. Next slide, please. A very special memorial that we'll be adding, and as Mike had referenced, the renovation that's happening in the parking lot to help with the reclamation of rainwater runoff is the Gold Star Family Memorial. And that will be, again, along the north end of our parking lot, fairly close, if you're familiar where the General MacArthur statue is located. And the gentleman who started this foundation, Herschel Woody Williams, is still with us. He is a World War II Medal of Honor recipient, one of only two that are still alive, and he was an Iwo Jima veteran. And the teams in Rotary that we're working with here in Milwaukee have developed this campaign to place this, and it will be a wonderful addition on the north end outside for the community to take in and reflect on the sacrifice and service. And target date is an approximate date within August, but again, still to come, and that'll be a wonderful addition to that new park-like setting that is being developed as we speak. Next slide, please. A new program that we will be hosting every year, and it will actually normally be on Memorial Day weekend, but again, with consideration for the current environment, we decided to add this to our opening of the victory in Japan in the end of World War II ceremony. It's a field of flags, and I first experienced this in Boston, and that's the photo that you can see in there. That's at the Boston Commons, and every Memorial Day they plant just over 33,000 flags in the park-like setting. We will launch that this year, and again, this year we'll be focused on the 2,972 flags, and that will represent was the number of Milwaukee citizens killed in action during World War II. So each flag will actually have an individual represented behind it. And we will continue that for years to come. But this year we were very fortunate to have the sponsorship and support. And I think it'll be a gorgeous addition temporarily. It'll be in place for that long weekend, and then we'll be removing those. So that'll be a wonderful event to participate in on the 29th. Followed by the one and only traveling World War II memorial. And you'll see an image of that on the next slide. That's an image of the one that's in DC, and many of you are familiar with the Honor Flight, and that's where many of them were initially going. And there's a traveling replica of that. It has never been to the Midwest. We will have that here on display August 30th to September 3rd. And to give you a visualization of where that will go on Fitch Plaza, on the next slide, you can see where we were setting up for one of our past Vet Fests. And so it's overlooking the beautiful setting of Lake Michigan. It's on Fitch Plaza. And so it fits within that footprint. And while the one in DC has a waterfall to the front, this will obviously have Lake Michigan to the back. And we'll be hosting that on the first weekend of the first few days of September, which will then mark September 2nd, which is victory in Japan and ultimately the end of World War II 75 years ago. And so we look forward to that event to really be a bookend of the 75th celebration for Wisconsin, for Southeastern Wisconsin, and to re-engage. We do have a summary of events that have been shared with you, and on the next slide you can see some of the various activities. We've shared that with the Greater Milwaukee Committee, and you'll receive that as a follow-up. And any questions that you have on these events, activities that you'd like to participate in, we do have contact information on there. But again, it's an incredible year to mark for what occurred so many years ago, and we will be honored to remember those and then continue to conduct activities for those who are still with us and the family members. And so don't hesitate to reach out if you ever have any questions. And we do quite a bit in our newly designed newsletters to talk about the the activities that are coming up. So thank you again for the opportunity to present the wonderful ceremonies that we'll be hosting as we get further into 2020 for the 75th.
Dan and Mike, thank you for the important update on all the work that you're doing on behalf of the War Memorial. And I'm pleased to report that the War Memorial was one of the GMC's first large capital projects, and the GMC played an important role in its creation in 1957, as Dan reported. Now I'd like to introduce today's keynote speaker, Jim Skogsbergh. Jim is President and CEO of Advocate Aurora Health. Advocate Aurora was formed in 2018 following the merger of Illinois-based Advocate Health and Wisconsin-based Aurora Health. Jim had been the CEO of Advocate Health since 2002. Just to give you a few metrics, Advocate Aurora is $12 billion in revenue. They serve 2.8 million patients. They have over 3,000 physicians and over 70,000 employees. For the past 9 consecutive years, Jim has been named one of the 100 most influential people in healthcare by Modern Healthcare. He is a national leader in the healthcare sector and speaks regularly on healthcare transformation, innovation and reform, quality and cost, patient safety, and healthcare providers' commitment to serving their communities. I'd just like to remind everyone, again, the Q&A is open. If you have questions, please submit them. Otherwise, Jim, it's a pleasure to turn it over to you, and we're all interested in hearing about the many challenges of running a healthcare system during this crisis. Thank you.
Thanks, David, for that kind introduction, and thanks to you and Julia for the leadership you provide to GMC. I'm pleased to be with you today and to share a little bit about our story of how we're dealing and coping with COVID-19. And I know that there's a lot of folks out there that are anxious and interested in how our healthcare system is performing and responding to this pandemic. Let me begin. I'll just narrate a little bit, and I'll invite Julia, you or David to jump in and lead me into any direction you'd like to go. But let me start with numbers, because it seems everybody is interested in how many COVID patients do you see and how many do you have in the hospital, et cetera, et cetera. So I'll just give you big picture numbers. Advocate Aurora Health, the two-state system, today, this morning, has about just shy of 700 patients that we're treating in our facilities, 684 to be exact. That's about the same as it's been for quite some time. So we would like to say that our numbers are flattening. We are not yet on the downhill side of this, but our numbers are flattening, which is good. We're looking for any kind of positive news. And a flattening of the curve is good. We're anxious to see it start declining, of course, throughout our system and throughout the state of Wisconsin. So by perspective, we've got about 100 patients in our facilities in Wisconsin. And I'll contrast that with in Illinois, we have about 600. So for every one patient we're treating in the state of Wisconsin, we're treating 6 in the state of Illinois. So that's also kind of a good thing. So our demand and the number of patients that we're seeing in Wisconsin is relatively light compared to Illinois. As you might expect, our largest volumes are at St. Luke's, if you will, our flagship, so to speak, in the Milwaukee area. But we have patients, at Sinai, and we have patients at South Shore and West Dallas, and we've got patients up north in Green Bay, et cetera. But they're relatively small numbers, which we're fortunate to have that circumstance. So that's sort of a status of the volume, a flattening of the curve for us. Not yet seeing the downhill side of this, anxious to get to that point, but continuing to care for COVID patients at all of our, almost all of our institutions. I think we've got in Wisconsin maybe 6 that have seen 0 COVID. So we're fortunate in that regard. What this pandemic has raised up, that really wasn't necessarily a huge part of my time and energy, because of the great leadership we have at Advocate Aurora Health. But this notion of PPE, which now everybody knows, PPE stands for personal protective equipment, but PPE and testing has taken on an enormous place of importance in our institutions. And I know I'm speaking for all of my healthcare colleagues throughout Milwaukee and Wisconsin. PPE and testing is the topic of conversation that it seems to occupy most of our time. So I would say a mass effort to make sure that we are protecting our caregivers. And I can't say that strongly enough, this notion of protecting our caregivers. And yes, of course, we want to protect our patients. That goes without saying, but you need to have a workforce available to care for these patients when they present and when they get sick. So we've got amazing leadership in our supply chain, and they have, with no exaggeration, scoured the globe to secure appropriate PPE for our staff. We had a plane that was on the ground in China and loaded up and ready to come back, and we had a little circumstance where some of the material was taken off of our airplane, but then we were allowed to return. So we are really scouring the globe for PPE, and we're in, I would say, pretty good shape. Now, I say pretty good, which is not a clinical term, by the way, but I say that because as we ramp back up and open back up for services, the demand for PPE actually increases. So now that we have patients that we're seeing in our imaging suites, we want to properly gown and protect the staff that are doing those procedures. We open up our operating rooms. We want to properly protect our staff that are caring for those people in the ORs and so on. So the demand for PPE is going to increase, not decrease. And so we're ever vigilant about PPE supplies. I'll pivot now and then say a word about testing, although I know we've got our guest from Quest, and John Raymond's going to jump on, and he's been a great colleague throughout this whole pandemic. But the testing focus has been, again, quite laser-like. And we probably, as a nation, feel like we were a little bit behind in the testing when this hit. I think that's an accurate statement, with no guilt or blame being placed. But we probably were not as prepared for the testing demands as we otherwise could have been. And I hope that's one of those things we rectify going forward, because I suspect, unfortunately, this won't be the last time that we're struck with something like this. I hope it's a long time before we are again, but it probably won't be the last time. So the testing focus, because of limited supplies that we've all heard about, at Advocate Aurora Health, and for almost all of my colleagues, our focus has been on our patients and on our team members. Our testing has been with our patients and our team members. We've really not been able to do much community-wide testing given the limited supplies. Now that's changing, and our guest a little bit later, thanks to Quest and thanks to the state, we're seeing some more supplies being made available, which allows us to open up and do community-wide testing. But for the most part, our testing has been really just for our patients, and obviously symptomatic patients that present, and our own team members. Some people might find it of interest that our organization, and we're large, we have probably 70,000 team members, but we have 700 of those, almost 800 of those, I look at my notes, that are out right now for quarantine. So our own folks our own caregivers that have been exposed are out for quarantine. And of course, they come back when they're asymptomatic for a period of time. But those tests that we're talking about are really dedicated to our patients and to our own caregivers. The next question, it's actually not even the next, one of the first questions we get is, well, what kind of a financial impact has this had on your organization? And in a word, it's been an unmitigated disaster financially, economically, and that's true with any business that is forced to close or shuts down significantly. Our volumes, our revenue is about half of what it normally is. And most people on the call today can appreciate if your revenues are at 50% and your expenses are the same or actually higher, and they're higher because we're paying more for PPE, they're higher because we've kept all of our own team members whole, whether you were furloughed to go home, whether you're working fewer shifts than you normally were scheduled, we're paying you for your scheduled shifts. And we're paying exorbitant rates for some PPE. All of our expenses have gone up and our revenues have been literally cut in half. So, and to put that in perspective, again, every healthcare institution based on their size, you know, this might vary, but I think we were, let me say it this way. We started January and February in the first 2 weeks of March in a very good situation financially. So we had good January, we had a good February, we had a really good first 2 weeks in March, and the last 2 weeks in March changed all that. Literally wiped out the first 2.5 months of the year, and we posted a loss in March. Our numbers are in for April, and our revenues were off, I think, almost $300 and some million just in Wisconsin. So it's quite a financial challenge, and I know people are anxious about that. They ask about it a great deal. One of the many great things about Advocate Aurora Health is that we're very strong financially. Now we do see that ebbing away a bit in March and April, but we're quite anxious to get back to work for obvious reasons. And part of that is to make sure we're putting our people back to work, because that keeping whole reference that I made throughout March and April and all of May, we're going to be changing that a little bit in June. And as we ramp back up for services, and again, that's was said earlier, it's more like turning a dial than flipping a switch. As we ramp back up for services, we're going to be bringing people back to work. So our ambulatory clinics, as they open up and we're seeing more patients, we're going to call those people back. As our operating rooms open up for surgical procedures they're not urgent or emergent, because we've always been doing those, but these are now cases that we can put back on the schedule and take care of the needs of our community. As we bring those cases back, we'll bring back staff, and consequently, we'll be reducing the amount of pay for furlough team members starting in June, and kind of gradually stepping it back. As we bring people back to the workforce, we're going to pay less and less in furlough pay. And we've got, I think, one of our commitments to be a great employer. So we've expanded our PTO bank. We're allowing people to borrow against it. People can get cash from it to a greater degree than they've ever been able to. So throughout this, we're attempting to be a great employer, and I think we're meeting that goal right now. So we feel great about that. So there's the financial impact. I will also say that the interesting contrast for us, and I suspect it's for a lot of organizations that are kind of working their way through this COVID pandemic, is that while it's been damaging economically and financially, culturally it's been strengthening for us. This organization, Advocate Aurora Health, has come together like never before, and the courage, the determination, the commitment of our team members. We have folks from Wisconsin coming down and helping out in Illinois, and folks that are prepared to do the same, vice versa. It's been, I think, strengthening for us as an organization. I know Nietzsche said, "Whatever doesn't kill you makes you stronger," and I know that sounds sort of flippant, but the truth of the matter is, this has been a tremendous challenge that our people have responded to magnificently, and as a result, our organization culturally has never been stronger, and I feel really great about that. So very proud of the 70,000 team members, and roughly 8,000 physicians that are part of our family. So culturally, we're stronger than ever, and we're anxious to remedy the financial challenge quickly. Which brings me, if you will, to my last comment, which is sort of getting back to business. We are anxious to do that for all the reasons that our other business owners are, and we're in the process of doing just that. So last week, and we're actually better able to do that in Wisconsin than we are in Illinois right now, because of the COVID population in Illinois is so much greater. But in Wisconsin, we're opening up all of our ambulatory clinics. We're opening up our imaging services. We're opening up our operating rooms. And what we want to do is encourage our patients to come back to us. Now that seems a bit odd because for the last 6 weeks, 8 weeks, everybody in healthcare has been saying stay away, that it's not safe, and we want you to stay home and isolate yourself, and so on and so forth. Well, the truth of the matter is it's not safe for our patients who need care not to get it. And so I'm one of those that believes that we're going to be living with COVID for quite some time, perhaps the next 18 months at a minimum before we get a vaccine. And I'd love for John Raymond and our guest from Quest to tell me that it's going to be a lot sooner than that. But if that's the case, we're going to have to learn how to live in a COVID world, just like our business owners are going to have to live and learn how to produce their product and provide their service in an environment that we know is not completely COVID free. And we're in the process of doing that. So we've introduced the Advocate Aurora Health Safe Care Promise, where we're telling all of our patients that your safety and your health is our highest priority. And we're taking additional measures to protect you and our team members as you come back and receive services that you need to maintain your own health. And we are prepared to care for you. And it's basically 5 areas of focus, and that's screening. All of our patients and team members, providers, all guests are going to be screened prior to entering our sites of care. Masking is going to be for everyone, that they're going to be provided masks prior to entering our sites of care. Social distancing we know works, and I know John Raymond will probably say a word about this shortly, but we know social distancing works, and all of our waiting areas and have been newly designed to accommodate appropriate social distancing. We'll have staggered appointment times that are going to reduce traffic and minimize contact, and we're going to create safe spaces for everyone. Virtual check-in through our LiveWell app. We're going to provide seamless, low-contact check-in process, which is also going to make it safer for our patients. And then without a doubt, enhanced cleaning. All public treatment areas undergoing additional cleaning and disinfectant throughout the day, and hand sanitizers can be readily available, and so on and so forth. So we're introducing our Safe Care Promise as a means of encouraging our patients and giving them some confidence that they can come back and receive the care that they need, and in some cases desperately need, because at the end of the day, it's that's why we're here. And so we want to care for you, and we want you to know that we're taking every step possible to make sure it's safe when you return to Advocate Aurora Health. And by the way, I know I'm speaking for all my colleagues in Wisconsin that are doing the very same thing. So we're all anxious to get back to work and to take good care of you, and we're taking all the appropriate steps necessary to do that. Why don't I pause there, and I'll let Julia or David, if you have additional questions for me, I'd be pleased to answer them.
Great. Well, thank you, Jim, and thank you for giving us, I think, a great overview of where the healthcare systems are now, and especially the work that Advocate Aurora is doing to prepare for, as you said, our COVID world that's going to be here for a while. So we're getting a couple of questions that have come through. One is, when will the clinics open for appointments?
They're open now. Our clinics are open now, and you can call directly. We've got new procedures, as I said, in process, and so they may have you actually park outside before they call you in, but you should feel free to reach out and call, because our clinics, our ambulatory clinics, are open, and we are seeing patients.
Great. We've got a question too about telehealth. I mean, people have really, I think, learned how to make telehealth work. How do you see that as in the future of medicine? And
so telehealth, or what we're calling virtual visits, Julia, have been I don't know, one of those silver linings in this dark, dark cloud of COVID-19. And I think we have at Advocate Aurora Health, I think we just surpassed our 100,000 virtual visits. Now, again, 2 states, but 100,000 virtual visits. It is a technology and a capability that I think we will embrace long after COVID is in our rearview mirror. You know, it allows for improved access. It's going to be easier for our patients, for any consumer, to do via this venue, if you will, versus having to come in. Now, when you have to come in, by all means, we're going to be capable of taking care of you. But the virtual visit thing, I believe, is here to stay, and I'm a proponent of embracing that technology. The other thing that I think we'll continue to see, and that is this notion of remote work, right? Working remotely. All of us are working remotely today, and I dare say that we will continue to do that, and perhaps reduce our real estate footprint, so to speak. We're finding people that are kind of settling into this new normal, if I can use that word. And people are productive, and particularly in the summertime, we're a little bit anxious if camps are not going to be open, and in the fall if schools don't open on time, and so on. A lot of our folks are going to want to be home with their children, their young ones, and so we're wondering how we can accommodate them if that need arises. So I think virtual visits going to be with us for a long time. A greater reliance on working remotely, I think, is going to be on us for a long, long time. And I do think that we're going to be better prepared next time around with, what I'll call the PPE and the testing, the basic requirements for handling these kinds of pandemics. I'd like to think that the United States and your caregivers are going to be well prepared next time around.
Yeah, that's an important point, because whether there's a surge or, God forbid, a different kind of pandemic, being prepared is going to be important. This is a question from Nancy Hernandez, and she says, as a healthcare leader, what is your biggest concern as we loosen up and begin to reopen? And what are your top recommendations for the Milwaukee community?
Yeah, Nancy, thank you. Good question. And I know John will be speaking to this here shortly. There is no doubt that in cases like this, you really must trust the science. And I believe that that's critically important for all of us. And social distancing does work. And so as we open up the economy again, and we need to do that, I am fully supportive of the plan to get our economy back running again, and Badger bounce back and safe restart and all the good work that's being done to do that. So we are a business just like all of you, and we're anxious to get started again. So we're big believers in the screening. I think screening is important. I think the testing is important. I think the social distancing is important. Those are 3 basics. John Raymond will speak in a moment and give you a more comprehensive list, but those are the things that I think we collectively need to embrace, and I mean fully embrace. And if we don't, I think we bear some risk of seeing a bounce, an increased number of COVID patients, which is not in any of our best interests. So we have to be diligent and we have to be vigilant. Was there a second question to that, Julia, or did I answer both?
Yeah, actually there is one more question out there. And this probably goes back a little bit to, you think about 5 months ago, I think, when we asked you to appear on this, who would think it would be it would be virtual, and the other thing is that we would be dealing with what we're dealing with. And so this question is about, as healthcare has been changing in past years, how might this pandemic accelerate already planned permanent changes in the delivery of medicine, particularly in underserved communities? Yeah,
sure. So I think it's heightened the awareness of underserved communities without a doubt, and that's not a bad thing necessarily. More attention to health disparities, health inequities, I think is a good thing. And Advocate Aurora, all my colleagues in Milwaukee and throughout Wisconsin and in Illinois, a strong focus on taking steps to deal with that, and we are proud to be a part of it. But on a bigger scale, I think that I'm one of those that believes that this chapter is not yet written. So I know that folks are early on saying, here's some permanent change that'll take place in healthcare. And here are the things that we think will continue long past COVID. I've named a couple of them that I think will stay with us. Working remotely, I think will stay with us. And you know, the screening and the testing, those kinds of things are gonna stay with us. A focus on safety, and that encompasses PPE and testing, I think will stay with us. I also believe that we're in the process now of identifying flags or early warning signals that I think can be in place, so that we know if something's going to be hitting us, so we can prepare for that in advance. But on a bigger scale, I'm not sure this chapter is fully written yet. So I believe that we will be adding to that list in the months that are ahead of us in terms of permanent changes. In some cases, some things won't change as a result of COVID. I mean, the focus that we have as an industry on safety and health outcomes, the focus that we have on reducing the cost of healthcare, that certainly hasn't changed. And I think you'll see that as sharp a focus as ever. But I think we've raised awareness around what you just pointed out, Julia, the health disparities that are evident in all of our communities that need to be addressed. And we are a big part of that, but we can't solve those problems by ourselves. This is a societal issue, and we're going to need all kinds of partners to address those. And we are pleased to be a partner, but we'll have to partner with others to address that. So I think some great things are going to come out of it, but I also don't think that list is quite complete yet.
Okay. Well, Jim, I really appreciate your thoughts and also sharing your perspective on where we are today. So I'm going to turn this back over to David.
Thanks. Pleased to be with you.
It's a real pleasure.
Thank you, Julia, and thank you, Jim, for your strong leadership and your steady hand in managing Advocate Aurora and the very important role that it plays in the wellness of our community. We will now hear from Dr. John Raymond, CEO of the Medical College, for an update on our local COVID-19 status, and then from Jim Davis, President and CEO of Quest Diagnostics. And as mentioned, Quest is a major producer of testing equipment, the test kits that we've all been clamoring for. And I'd also like to just have a quick shout out to Andy Nunemacher for putting the GMC in touch with Jim Davis. So with that, let me turn it over to Dr. Raymond.
Yeah, thanks, David and Julia. And I want to thank Jim Skogsbergh for the great presentation and for being a visionary leader and a super colleague. It's wish we would have been working closely together under different circumstances, but it's great to have a leader like Jim in our community. So good afternoon, everybody. I want to go on to some indicators of our progress on COVID-19. If we could have the first slide, please. The doubling times for COVID-19 have slightly improved to 14.5 days in Wisconsin and 18.2 days in Milwaukee. The daily growth rates over the last 7 days have been relatively stable at 3.9% in Wisconsin and 2.9% in Milwaukee. And there were 280 positive tests in Wisconsin yesterday, down somewhat to the second lowest number this month. And there were 98 new positive tests in Milwaukee and 63 new cases in Brown County, also down somewhat. There were 8% positive tests in Wisconsin and 12% positive in Milwaukee. And both of these are Badger bounce back indicators, so I wanted to make sure that I brought those to your attention. COVID-19 diagnostic testing capacity continues to increase, and for the last week has been stable at about 13,800. And we haven't really fully utilized that capacity yet, but it's there. ICU and ventilator capacity are stable, and they have been adequate. And as Jim mentioned, PPE trends are improving and stable, but they're going to continue to be problematical for us, especially as we begin to open up regular services in our healthcare systems. Currently, the most critical shortage is of gowns. Next slide, please. The next slide shows COVID-19 positive tests in Wisconsin and the trends over the last month and a half. And you can see that there seems to be a plateau both in Milwaukee and Wisconsin, but not a clear downward trend of new cases yet. Now, this isn't surprising because our testing capacity and number of tests administered have been increasing, but we're also aware that there have been a significant number of institutional outbreaks that are real increases in the number of positive tests. There's some good information here too about over the last week. The number of tests administered has been increasing, ranging from 3,500 to over 5,000 tests daily, and we'd love to triple that so that we can use the existing capacity in the state. This next slide shows COVID-19 related deaths in Wisconsin and in Milwaukee County. Now, fortunately in our state, our deaths are much lower than in many other states, especially those that surround us. Now, it appears there might be a downward trend in both Wisconsin and Milwaukee in terms of deaths, but there's significant variability caused by relatively low numbers. Next slide, please. This next slide shows the trends of daily tests administered in teal bars and the total positive tests shown in pink bars. And Milwaukee is shown on the left and Milwaukee shown on the right and Wisconsin shown on the left. And the black lines show the percentage of positive tests over the last 2 weeks. So both the numbers and the percentages of positive tests are Badger bounce back gating criteria. So these bear watching. Next slide, please. Now this next slide shows the trajectory of growth of COVID-19 in Milwaukee. Could we have the next slide, please? Well, I'll describe it and hopefully it'll pop up. But basically what the slide shows is 2 plots. One is Milwaukee and the other is the rest of the state. And the vertical, yeah, there we go. Okay. So the vertical axis shows the total number of new cases in the last 7 days. And the horizontal axis shows the total number of cases since we began counting them in early March. And the data are shown on a logarithmic scale to make it easier to detect downward trends. What we want to see is that the number of cases that occur over the last 7 days will start to bend downward. And the plots show that Milwaukee had done a bit better than Wisconsin in bending down the curve. But about 2 weeks ago, that downward trend was not sustained, and we began to bend upward a bit. And again, if you think about this plot, if you're going up at about the same rate as you're accumulating new cases, you're not losing ground, but you're also not gaining ground. So as Jim mentioned during his presentation earlier in the meeting, we kind of reached an equilibrium with COVID-19, but these plots would suggest that our progress may have stalled somewhat a few weeks ago. Next slide, please. So if we've stalled, did we stall in a reasonable place? And I think Jim hinted that the answer is yes. And I agree that the answer to the question is yes. Most importantly, we've never overwhelmed our hospitals, our ICUs, or ventilator capacity. And you know, that was one of the primary goals of flattening the curve. So to explore this idea just a little further, I'd like to introduce one more set of data that suggests that we've reached an equilibrium with the COVID-19 pandemic here. Now this graph plots the reproductive number, or the R0, since March 12th. And the reproductive number measures the contagiousness of a disease at any given point in time. So for example, if the reproductive number is 4, it means that one infected individual, on average, can pass the infection on to 4 other people. If the reproductive number is 1, then one infected individual spreads the infection to 1 other person. So ideally, we'd like to see the reproductive number be less than 1, because then the pandemic would start to fade away. And I think anybody that's been following the story in Germany knows that when they reopened, they were watching their reproductive number very carefully as a potential early indicator that they might be going in the wrong direction. And Jim had mentioned that we needed some of these early indicators, a canary in the coal mine, so to speak. And I would propose that the reproductive number is one that we should pay attention to, especially as we begin the smart restart or the phased reopening of our economy and the Badger bounce back. So back to the graph. I'll call your attention to the blue line, which shows the reproductive numbers for Wisconsin over time, and the tan line, which shows the reproductive numbers for Milwaukee over time. Now, starting from the left, you can see that we started with high reproductive numbers back in early March, at about 3.5 in Wisconsin and nearly 5 in Milwaukee. So that means that the pandemic was spreading very rapidly. But by early April, the reproductive number had dropped to about 1 for both Milwaukee and for Wisconsin. And I believe this reproductive number improvement is directly attributable to social distancing and to people staying at home, as Jim mentioned earlier. But we've stayed around this reproductive number at or near 1 for the last 5 weeks without continuing improvement and without a noticeable worsening. So hence we have reached an equilibrium or a steady state with COVID-19. So what does that mean for us when we begin a smart restart of our economy? I think quite simply it means that we'll all need to maintain diligent adherence to social distancing if we want to avoid a surge of cases. Now I understand that there's lockdown fatigue, but it's clear that we'll need to redouble our social distancing efforts until we have a vaccine, and if we want to successfully and safely reopen our economy. I do want to thank you again for the opportunity to speak here, and I'd be happy to turn it back over to David and Julia to answer questions.
Thank you, Dr. Raymond. Actually, I'll be taking the questions. This is
Elmer.
Good to see you again.
Yeah.
So, Dr. Raymond, I first have to just thank you. You have really shown an extraordinary talent for making what could be very complex information accessible. And with that, I would also like to invite all of our viewers to contribute your questions when you have them. This is rare access to Dr. Raymond, and we want to make sure we take the best advantage of it. So let's get to the questions. Mr. Steve Resch says, of the deaths in Wisconsin and Milwaukee, can you tell us how many or what percentage of them are people over the age of 55 with vulnerable health conditions, or with vulnerable health conditions?
Yeah, thanks, Steve. Great question. I'm going to ballpark it because I have not looked at the Milwaukee County and the Milwaukee City websites today, but generally more than half of the deaths occur in individuals that are over 55, and that trend has persisted here. In terms of patients that have pre-existing conditions, again, more than half of the patients that die are either aged or have a pre-existing condition. And the most important pre-existing conditions in terms of medical terms would be obesity, hypertension, and diabetes. But I will also say, especially here in Milwaukee and what's playing out over the rest of the country, that a pre-existing condition could be your ethnic group or the neighborhood that you live in. In particular here, African Americans, and to a great extent also Latino and Hispanic communities have borne a disproportionate burden of this disease and have had a higher mortality rate. And so that's something, if we're going to be smart about reinvigorating our economy here, and if we care about social justice, we really need to pay attention to those neighborhoods.
Thank you for answering that. Greg Nickerson asks, have you been able to quantify any increases in suicides, abuse, overdoses compared to the norm?
Yeah, great question. I think there's a growing awareness that all three of those, suicides, abuse, especially domestic abuse, and overdoses probably are increasing. Social distancing creates loneliness. Lockdown creates boredom and despair. And so those are some of the unanticipated consequences of having the social distancing. And I think it's important that all of us reach out to our loved ones to make sure that they stay connected. And you know, MCW had to furlough over 700 individuals, and we're trying to be mindful to provide them with social and mental health support services as they go through this furlough process. And it's just a very huge challenge, I think, for all of us.
John, I think this is Daniel Johnson, rather. What do you see as necessary protocols for colleges and universities come this August?
Boy, I get asked that question all the time, especially for colleges and universities that have dormitories and cafeterias where there may be high density of interactions. There's no good answer right now. Absent an effective therapy or a vaccine, which we're very likely not going to have this year, it's just hard to say. And what I would point out is, although young people tend to either be less likely to have morbidity and mortality from COVID-19, they certainly can get it. And we're learning more and more, especially in children, that they can have devastating consequences from that. So it's just such a tough question to answer. And I don't know how you can socially distance young people who want to have a college experience, a large part of which is interacting with other young people and with your teachers. So that's a tough one.
Dr. Raymond, I'd love to conclude with this question, which is my own. As the leader of an academic institution which focuses on providing, our future generations of healthcare workers, I wonder what you are seeing in terms of changed motivation for participation in the profession, if students are more or less excited to risk this kind of work and so on.
Yeah, great question, Elmer. I think for the most part, our students are frustrated that they've been removed from the front lines. Part of that was to uncomplicate the healthcare environment when we were in the initial phases of COVID-19. And I'm only talking about this region, but part of it was to preserve personal protective equipment. Our students, for the most part, want to be there. They want to find ways to help. I think, if anything, it's invigorated them and really infused a strong commitment to service in our students, which, as you know, we always try to pick students that are properly motivated anyway. But I think you're gonna see people even more motivated to do the right thing. And Elmer, what I'm hearing from a lot of our students is they want MCW to lean into the African American and Latino communities, to be an ally, to take our talents and our treasure and to deploy those to the benefit of everybody that needs us in society.
Dr. Raymond, thank you so much for being a regular participant in this biweekly call. Really appreciate all that you've done for us and the GMC.
Thanks, Elmer.
So very excited to invite Jim Davis to now present. Jim?
Yes, so good afternoon, and thank you, Dr. Raymond, for your leadership here in the community. And Jim from Aurora Advocate, thank you as well. We're blessed with two fine institutions here in Wisconsin, so thank you. Let's go to the next page. So I don't think I've had a tie on since about March 15th, so that's a rather old picture. I work for a company called Quest Diagnostics, which is headquartered in New Jersey. And so the question, why do I live in Wisconsin? I came to Wisconsin in 2001 to work for GE Healthcare and had a fruitful career at GE Healthcare, running their MRI business as well as leading their America's commercial organization. Prior to that, I had a lengthy stint in GE's aviation business, and prior to that worked for McKinsey & Company for a number of years. I'm a resident of Brookfield, Wisconsin, and the reason I never moved to New Jersey is, one, our family loves it here, and two, I have a son. I had 3 children, my youngest of which is just graduating this year from Marquette University High School. So we're a little bit free after this one, but we don't plan on leaving Wisconsin. We love it here. So next page for a moment, please. So just a little bit about Quest Diagnostics. You may not know us that well here in the state of Wisconsin. I think on the Illinois side, we're a much more known entity just based on our volumes and level of work we do in the state of Illinois versus Wisconsin. But we're about a $7.5 billion corporation, at least we were in 2019, similar to what Jim mentioned. We've been hit very, very hard by this impact as well. Although we're getting a lot of COVID testing, which I'll talk about, the core part of our business is down, similar to what Jim said, about 50%. We've got about 47,000 employees. And during this pandemic, I would tell you that about 30,000 of them are going to work every single day, meaning they're going into a laboratory. We have about 12,000 phlebotomists that draw blood and collect urine. We have couriers. We have airline pilots that fly airplanes. And so about 2/3 of our staff are actually working every day. About 1/3 is, like myself, working from home. We've got 23 laboratories nationwide. Our nearest laboratory is in Jim's backyard, right on the west side of O'Hare Airport in Wooddale, Illinois. We do today, or in 2019, I should say, before the pandemic, in any given year, we test about 30% of all Americans. We touch and get requisitions or lab tests from over 50% of the U.S. physicians. We serve about 50% of the U.S. hospitals, so all hospitals have their own laboratories, but in many ways we partner with them on tests that they choose not to do or can't do. And then when our volumes are at normal level, we will test upwards of 550,000 unique patients per day. We're blessed with over 2,200 patient service centers where patients can come and have their blood drawn or their urine collected. As I mentioned, 12,000 phlebotomists. Every day around 3 o'clock, we'll send out 3,700 couriers and cars to pick up specimens from physician offices, our own patient service centers, and from hospitals. And then regardless of where our labs are, we move specimens to our laboratories. So even though we may not have a laboratory in Wisconsin, we're very adept at moving specimens either to Chicago, where if our Chicago lab is out of capacity, we can quickly put them on a Quest-owned airplane and move those out to Kansas City, our next closest airport. And at the bottom here, we say we have access to about 90% of the U.S. insured lives, meaning we are in network with United Health Care, Aetna, the Blues plans. There's only about 10% of the U.S. lives that we can't serve for insurance purposes. We are also a good partner of the Aurora Advocate system. We work closely with Jim's lab, and I know we would do work as part of the Froedtert system in Medical College of Wisconsin as well. So next page, please. You know, the lab industry, you know, is sort of this sort of below the radar industry, if you will. You know, the Aurora Advocates and medical colleges of Wisconsin, they touch and see patients every day. And we're sort of a service provider to physicians, to hospitals. But whether we like it or not, we've been in the forefront of the news media. And I think it has brought a lot of focus to this industry. And as Jim mentioned, there'll be a lot of would-haves, should-haves, could-haves about what went well, what didn't go well. But at least we're pleased to be in that forefront and pleased to be able to help, you know, America as we work through this crisis. So next page, please. All right, so if we look just a little bit at a timeline here, I think if we go back into January, the World Health Organization declared a public health emergency. We also have a partner lab. While we're largely a US-based company, about 95% of our revenue is here in the US, we do have partnerships with laboratories around the globe, and we have these partnerships because we do clinical trial work as well for many drug companies that require us to have partnerships with wherever the new agents are being tested. So we have a unique relationship with a lab in China called KingMed. And I can assure you, we started to see here, talk to researchers at this laboratory in China. It's their largest independent lab. And so we knew exactly what they were seeing. We talked to their researchers. And I can just assure you that we certainly tried to get testing up and running before we first launched a test on March the 9th. There's a regulatory process in this country that requires us to get regulatory approval if we develop our own test. And we did develop our own test to check for the virus, as well as we partnered with companies like Roche and Hologic that develop their test kits, and then we buy those test kits and bring those tests to life in our laboratory. But for us, the key sort of bottleneck to getting the testing up and running here in the US was, one, we needed the CDC's permission. We didn't necessarily need their recipe, but we needed their permission, and we needed the ability to actually bring the live virus into the country in order to validate the assay that we wanted to bring up. And we weren't really able to do that, to get our hands on the live virus until the very end of February. And then it took us about 10 days from there to get the test up and running and validated. We launched that test in 2 of our laboratories with a capacity of about 10,000 tests per night on March 9th. And I can tell you right at that point, we were completely overwhelmed. So when you turned on these tests and requisitions, specimens started to pour in, ourselves and our nearest competitor, LabCorp, we were all behind the 8 ball, and it was taking us 4 to 5 days to work through the backlog of specimens that were accumulating. But by the end of March, towards the end of the back end of March, our capacity had increased over 50,000 tests per day. And I would tell you by the first week of April and even into the Easter week and after the Easter week, we actually had more capacity than we were getting demand for. So there was actually more lab capacity than specimens that were flowing in. And this wasn't just true for us, but it was also true for our nearest competitor, LabCorp. It was true in many of the academic situations. And even here today in Wisconsin, I believe we actually have more capacity on the ground between all the different hospital systems that have brought up the test, as well as Exact Sciences, who's done a terrific job in bringing up an assay there as well to help with the effort. We also launched an antibody test. Dr. Raymond didn't chat too much about that. We believe it's a vital piece of information. It's not a magic wand, but it's a useful piece of information for understanding what portion of our population has been exposed to the virus. We can't quite conclude just because somebody has developed and put up a response to, we've identified these, what we call IgG antibodies. We can't yet tell you, does that mean you're good for 3 months, 6 months, or 2 years? We can't tell you exactly what level of antibodies are required to fight off the virus should there be a second round. But at least we know from a public health perspective that that individual was exposed to the virus and developed some type of immune response to that. So next page, please. So we now have the ability to do both the molecular test, and this is also referred to as a PCR test, which detects the live virus in your system, and the antibody test, also referred to, you may have heard the word serology test. We offer this in 23 sites around the country. There has been a lot written about these antibody tests. The FDA, there's over 70 tests that are out there today. I think the FDA has only approved roughly 10 of those. We use 2 different assays, one developed by Abbott in Chicago, the second developed by Ortho Clinical, a former division of J&J. Both of these tests have been EUA approved by the FDA, and we have a lot of confidence in those tests. To date, we've done over 1.7 molecular tests across the country. That represents about 20% of the total tests in the country being done. And we've done about 650,000 antibody tests to date. I can tell you the positivity rate on the 1.72 million is what we're up to this morning, is about 15.7%. Here in Wisconsin, we've done about 14,000 tests, so we're not that well represented here. And we're seeing a positivity rate of 11.8%, which may have been higher than what Dr. Raymond referred to. And that simply could be because of the mix of testing that we see. We've been biased in our testing towards nursing homes, prisons, jails, as well as some of the FQHC clinics, which we tend to be seeing higher infection rates, as Dr. Raymond mentioned, in the inner cities. And we collaborate very, very closely, given the volume of testing that we do, with the CDC, federal, state, and local governments. We report out our results to all 50 states and counties and the CDC every single night, so that the CDC uses us and other large independent labs, as well as all the hospital labs, to assemble the statistics on what's going on from a spread standpoint. So next page, please. If we take a look at the testing that's been done here in Wisconsin, and let me first comment, actually, cases per 100,000 people before we get to the testing. We should feel great about the statistics on the left. We've only seen, and this was of last Friday, 141 cases per 100,000 people. The national average is 353, so we all conclude that the social distancing policies and programs that have been implemented are clearly working here. When it comes to testing, however, we lag the rest of the United States. So on average across the US, we've tested 2,225 people per 100,000. And in Wisconsin, we're only up to 1,520. I did look quickly this morning with Jim on the phone. In the state of Illinois, they're above the national average, having tested about 3,400 individuals per 100,000. And so I get asked frequently, because of the vantage point I have, that I get to see the testing across all states. I've worked with HHS leaders at the state level. And so I'm asked frequently, well, why is it that we're lagging in testing in the state of Wisconsin? And I think there's many reasons for that. I think there were delays in getting tests up and running at some of the health systems. They didn't have access, perhaps like Quest Diagnostics did, to some of the early test kits. We were blessed with working with the CDC and getting very quick access to the live virus to validate our test. And I think there's just been bottlenecks in the system here. I think, as of late, we've seen a strong partnership between the government and other entities to get more testing out into cities and counties. But I would say, two states I would cite, California and Massachusetts, that I think just had more national events with FEMA going. They've partnered with Walmart sites. They've had more pop-up events. They partnered with Optum Logistics to put up tents and facilities across California to get after some of the migrant workers. And so I think we're playing a bit of catch-up here in Wisconsin, albeit on the Illinois side of the border. I think they've done a really good job in reaching more and more people. So next page, please. Again, just a little bit on the cases per 100,000. We should all feel great about this. In Wisconsin, there's only 17 states that have fewer cases per 100,000 people. You see those on the right. However, again, from a test per 100,000 people, there's only 10 states that have fewer tests per 100,000 people. Now, again, I think the infrastructure is here, with Exact Sciences coming online and converting much of their colon cancer testing over to viral testing for COVID. And I think many of the health systems now, most of the health systems here in the state of Wisconsin also have tests up and running. And then we've been partnering with more and more of the physician groups, FQHCs, nursing home delivery folks that can get into nursing homes to bring the test capacity that we have in Wooddale, Illinois, to bring that up to Wisconsin as well. So if you look at the next page. Okay, so the topic of return to work, return to life, return to campus. I heard a question in the earlier conversations. We're talking with universities and colleges across the United States as well. And that is absolutely forefront on everybody's minds. How do we return to life, return to work, return to campus in a safe way that we can all stay healthy and not further the spread of this disease? So if you turn the page here, and what I would tell you is, lab testing is not the answer to returning to work and returning to campus. Lab testing, we think, plays an important role in that. But there are many, many important aspects to being able to safely return to an environment. So as we've worked with major corporations around the country, I think a few key themes come to mind here. First, what we see is it's a CEO-led initiative. It's top of mind to every CEO in the country. Close to the CEO is it involves HR, it involves your medical community within these corporations, it involves EHS, and to some extent it involves the legal community. We've had all sorts of questions on what can we force, and we face this in our own company. Can we force our employees to get antibody testing? Can we force our employees to get a virus check, a molecular test before they come back into the office space? And these are all great questions that we have to deal with. Second, again, I think lab testing testing plays a key role throughout the process. It's not a one and done type of process. You can be tested for the virus today. You can go out and have interactions with 100 people and you could be affected tomorrow. So it's not one and done. The serological testing, I think, plays an important role as well, as in terms of understanding your employee demographics and who was exposed and who wasn't. And to some extent, it sets up a future paradigm of how often people may need to be tested. This is, to a large extent, a cultural change in many environments: homework, schools, and elsewhere. How are kids going to behave in dormitories? Are we ever going to see a buffet lunch again in a work environment or in a college environment? But very much so, we need to retrain a good portion of America in terms of just don't come into the workplace, don't go into a classroom if you have any symptoms at all. And I know myself, and I'm sure many of you on the phone, have been trained over the years to tough it out. And if you have some sniffles, if you have a slightly elevated fever, it's okay to go into the office, keep to yourself, but it's okay to do that. And I think culturally that mindset really has to change here in the US if we're to safely reopen here. And then finally, as you all think about how do we reopen our workplaces, our universities, I don't think there is any one-size-fits-all program. We've been working with the major airlines, and how we think about pilots and flight attendants that are coming off a 3-day leg are very different than how we might think about manufacturing workers who can maintain 10 to 12 feet in between each other in an environment where they're not coming into contact with hundreds of people and customers. Likewise, I think retail employees versus production employees are very different as well, just based on their exposure to customers, consumers, and things like that. So this clearly involves a lot more than lab testing. I've seen incredible, thoughtful documents from IBM and Apple Computer around disinfection guidelines, social distancing, on-site screening, and self-monitoring. So a lot of good thought has gone into this across the U.S. Next page, please. What I thought I'd give you here on this next page is just, again, a quick framework to think about as you think about how to incorporate lab testing into your return to work, return to university policies. First, what we all have to ensure of is that anybody coming back into an environment is virus-free. And whether you do that on a risk-based, symptom-based way, or you simply check all employees coming back into your campus setting or workplace setting and check and make sure that they're not infected with the virus before they return. Now, a lot of companies are simply going to, these digital questionnaires around have you had any, what has your temperature been in the last 10 days? Have you had any symptoms at all? And if the answer to those questions are yes, then they're instantly sent for a viral check or a molecular test before they return back to the setting. Again, in the middle column here, we do think antibody testing does play an important role. It is, again, not a magic wand, but it's an important tool to understanding who has been exposed to the virus and who has not been exposed. I can tell you one large retail company that we are working with stores all across the U.S. Will be doing widespread antibody testing and combined with virus or molecular testing. And those that have tested free from a virus standpoint, those who have not developed antibodies, they will be sent on a regular every 2 to 3 week protocol in terms of making a virus check to make sure that they are currently still not infected with the virus. I think the next piece is this daily monitoring of employee health. We've talked to a couple large universities who are going to get their students and their faculties every morning to take their temperature and literally get into an online digital tool that is a self-attestation that they do not have symptoms. We think this is really an important tool to get people just to be self-aware and to sort of do a self-check every morning to make sure that they remain healthy. And then, again, we have to create this environment that it's a positive for an employee to raise their hand and say, I just can't come into the office today, or I can't go into the classroom today, and to not have any retribution for that should they need to miss a day of work or a day of school. Okay, and I'm sensitive to time here, so on this next page, I just give you a framework, and you can make this presentation available to everyone, of 4 companies, case examples of companies that we're working with, anyone from large retailers to a healthcare supplies company, to a medical device manufacturer who has service personnel that need to be in hospitals like Aurora Advocate in order to service radiology equipment, medical device equipment, and the health system really mandates that they get virus checked once a week before they can come into that institution. So I'll let you read this at your leisure. And then finally, just to wrap this up, again, widespread testing in Wisconsin, we do lag the national average. We do and are looking for more support and advocacy from the business community. Second, getting teams back to work is really a CEO-led initiative. Programs tailored to your industry segment and your employee segments are what's required. There is no one size that fits all. Lab testing, we think it's an important element, but not obviously the only element to a safe return to work or return to university. And then again, there is no perfect answer here for getting back to normal. You have to create an infrastructure, a system, and a culture that promotes a healthy way of living. And if you need any assistance or any further questions, there's some contact information at the bottom of that page. So Elmer, I'll turn it back over to you, and thanks for your time and attention here.
Thanks so much, Jim. Actually, for just this one moment while I do ask you a question, I'm going to ask if we go back one slide and just show those takeaways. I thought they were very helpful. So I just would love for you to further illuminate, Wisconsin is ranking poorly in the administration of tests. Can you give me some more clarity about why that is, and offer maybe some advice about how we can do better?
Yeah, so first I'm going to compliment Wisconsin on the cases per 100,000 because at the end of the day, that's the statistic that really matters. But in order to safely reopen here, we need more testing, both virus testing as well as the antibody testing. Again, the U.S. Health and Human Services and FEMA, they had sites up and running in March in probably 20 states. I don't quite understand the political process that enabled some states to have these sites and other states that didn't. That program has transitioned now to a partnership with Walmart. Both us and LabCorp and other labs are behind the testing behind that. We still haven't seen a Walmart-based site here in Wisconsin. We are starting to see partnerships with Walgreens and with CVS, and I think there'll be more news coming on that in the next week. But I think it's some of this is government-led, some of it is a little bit political. Hard to tell.
So I'm going to take the privilege of being the guy with the mic and ask a question from the Q&A. Linda Gordons-Levy asks, will the antibody testing essentially become as common as the viral testing? Will it be readily available and publicly available anytime soon?
It is readily available. There's actually more capacity on the antibody serology side already than there is on the molecular side. It's a much simpler, easier test to do. I'm sure my colleagues at Aurora Advocate and Freighter have brought that assay up. It's a simple test, widely available. And in many cases, at least coming to our company, you really don't need a doctor's order, with no disrespect to my healthcare colleagues. But if it's a useful piece of information that somebody wants, they can come and get that through a simple blood test. It's a full vial of blood. I would stay away from these finger prick tests that are point of care tests. We don't think they're reliable. The FDA has said as much, but the full vial of blood, assays seem to be quite good.
Thank you so much, Jim. I'm going to turn it back over to David.
Okay, thank you, Elmer, and thank you, Jim, for that tutorial on Quest and lab testing and its importance and where it stands today, both in our state and our country. I'd also like to thank Dr. Raymond, Jim Skogsbergh, Mike Grebe, and and Dan Buttery, all of our speakers, all of you who called in. We hope you found today's program of interest. We have our next program not on Monday, 2 Mondays from today, because that's Memorial Day, but the day after, Tuesday, May 26th. Please keep an eye out for the registration information. And on behalf of the GMC, I wish you all a safe and good week. Hopefully sunny and a little bit warmer weather. This meeting is now adjourned.